Metronidazole. Metronidazole is an antibiotic and antiprotozoal drug. Metronidazole kills bacterial cells and protozoal cells by free radical mediated damage to their DNA. Metronidazole is used to treat anaerobic infections below the level of diaphragm. One most important thing that you should note here is metronidazole ends with azole. There are other drugs also that ends with azole. For example, clotrimazole and methimazole. Clotrimazole is an antifungal drug, whereas methimazole is used to treat hyperthyroidism. So you should not confuse between metronidazole, clotrimazole and methimazole. So please do not confuse this azole of metronidazole with clotrimazole, fluconazole and methimazole. Mechanism of action: free radical mediated damage to DNA of bacterial and protozoal cell. Here this free radical mediated damage is very important. Clinical uses: anaerobic infections above the level of diaphragm are treated with clindamycin, whereas anaerobic infections below the level of diaphragm are treated with metronidazole. Some common examples for anaerobes are Fusobacterium, Actinomyces, Clostridium, bacteroides. Metronidazole is used to treat Giardia infections. Giardia causes non-bloody, foul-smelling, fatty diarrhea. Diagnosis can be made by cysts or trophozoites with many nuclei seen in stools. One most important thing is people who are deficient in IgA type of antibody are at increased risk for giardiasis. It is also used to treat Entamoeba histolytica infections. Entamoeba causes bloody diarrhea. Here in Giardia it was non-bloody, whereas in Entamoeba it is bloody. It is very important that you make this difference. Entamoeba also causes abscess in liver. On colon biopsy, you can see flask-shaped ulcer. This is apex of the ulcer and this is base of the ulcer. Metronidazole is used to treat common vaginal infections like Bacterial Vaginosis and Trichomonas Vaginitis. Here in Trichomonas Vaginitis, we already know that itis means inflammation. So there will be an inflamed red cervix, whereas in vaginosis there is no itis, so there won't be any inflammation. So bacterial vaginosis is caused by Gardnerella vaginalis, that is a pleomorphic gram variable rod bacteria, whereas Trichomonas vaginitis is caused by Trichomonas vaginalis. It is a protozoa. Vaginosis is not sexually transmitted, hence there is no need to treat sexual partner, whereas vaginitis is sexually transmitted, hence the sexual partner must also be treated. Again, here in vaginosis there is no inflammation, whereas here in vaginitis there will be inflamed red cervix. We also call it as strawberry cervix. In vaginosis, there will be white discharge with fishy smell, whereas in vaginitis, there will be greenish, foul-smelling discharge from the vagina. In bacterial vaginosis, if you mix white discharge with potassium hydroxide solution, there will be more fishy odor. This test is called amine whiff test. On microscopy, you can also see vaginal epithelial cells covered with Gardnerella. These cells are also called as clue cells. In vaginitis, on microscopy, you can see motile trophozoites in the discharge. Metronidazole is used to treat H. pylori infection in patients who have penicillin allergy. H. pylori causes gastritis and duodenal ulcers. H. pylori is a risk factor for malt, lymphoma, and gastric adenocarcinoma. Contraindication: do not give metronidazole with alcohol as it causes disulfiram-like reaction. Other drugs that also show this reaction with alcohol are chlorpropamide, tolbutamide. These are first generation sulfonyl ureas and which are anti-diabetic drugs. Cephalosporins also show disulfiram-like reaction. Griseofulvin and procarbazine also shows disulfiram-like reaction. Thank you.